Well, taking Tonka to the vet to get his staples out. He's very excited.
So excited. He's like, let's go to the vet.
He couldn't wait to get in here and go. He's feeling better. Oh. Riding shotgun? Oh. Here's Tonka. Yep, you can see. Same old Tonka. Gotta love him. I thought we were done with that back and forth once we got rid of the van, but I was wrong. Just gotta smell them all. So I'm really excited to see. Oh, Tom, you slathered on my head. It's okay. I don't care. I'm really excited to see if he is as excited to get to his vets as he normally is. Because he's usually super duper excited. Are you excited to be going to see Dr. Josh? Huh? You love him? Where are we at, Tom? Oh yeah, you can go see Dr. Josh? Are you so excited? It's so good to hear him be silly. He's so little booty. I love it. Oh, Dr. Josh. Oh, Dr. Josh. Okay, let's get out. Hey there, you lost any weight. Come on. There you go. Somebody smelled good today, huh? I can't believe you lost 8. 12? Did you have that big of a tumor, dude? I don't know who's been in here, but whoever it was, they smelled really good. There it is.
Mom's got to do surgery.
Yeah.
It's okay. It's okay, brother. It's okay, brother. It's okay, big guy. That's just Mom. Oh, baby. He's like, she ain't even got nothing sniffed yet, brother.
Yeah, I do. He was. Is Nick hungry?
Not now. I was earlier. If I don't eat right away, it goes away pretty quick.
That looks good. Yeah, it looks fantastic.
Yeah, it looks excellent. So I would rather try to take them out now
okay.
and wait.
Yeah, no, I would too. Yeah. Come here.
If they're getting better, they're
Come here. Oh, stop.
Stop it.
You gotta watch the video of me with his feet today. He does the same thing.
I know.
Hey.
Don't make me too much of a way. I can hardly see these things.
Listen. I know. It's okay. You're fine. We're gonna get those nasty things out of you. Look at that. He's not even making any noise. You are though, huh? You're making all the noise, huh? Silly boy. What a good boy. Oh my goodness, Tom. She's such a good boy. I really thought he was going to be much worse than this. Not just so grumbly. It's all good. No, he'd already. Him's a good boy.
We try not to say that until we're done.
Him's a good boy. That's my good boy. I'm so proud of you. Yeah. He says the worst part is just somebody holding me still.
A pretty incision.
It is beautiful.
Be able to tell.
Dude, you did such a fantastic job.
I slept at a Holiday Inn.
I remember that was.
Good boy. What?
We're almost
Yeah,
there.
I'm so proud of you. That's the bestest boy.
A couple of these are.
Look at that. Yeah, oh yes. That is, huh? That one's a little rough.
Yeah.
Is that one a little rough, huh? I forgot your cheese. What the heck?
No, man.
Mom, what's my cheese?
Forgot your cheese.
Tonka says I'll sit still for cheese. You can do whatever you want for cheese, huh?
Good.
That one stitch was up there still. I didn't manage to get it out.
No, they're fine. They're not gonna. These will.
I thought that was just the one for the tube.
It is. Yeah.
Best boy ever.
There.
Best
That's the one.
boy
You had already cut
ever.
it. It just didn't come out.
Yeah. Well, somebody was grumbling, huh? And wouldn't sit still.
Come here, Knucklehead. I want to see under your arm.
Come on. Come on.
I want to see under your arm here. There you go. Good. So the screw shield sutures are good. Okay, good.
Okay, so then essentially there's 2 grading scales for mast cell tumors we talked about. One of the ways to grade them is just high grade, low grade. So both his tumors that we sent in for histopathology came back as low grade tumors. There's also a 1 to 3 scale, 1 being the lowest and 3 being the highest. The large tumor that was on the flank came back as a grade 1, which is the lowest. The second tumor though that we sent out that was up in the kind of axillary region, that came back as a grade 2. They still consider grade 1 and 2 as low grade tumors, and so on the low grade scale it's low, on the 1 to 3 scale it's a 2. All of that is based off of like kind of how many mitotic figures are in there, whether or not there's lymphatic invasion. There's a bunch of different criteria that they look at when they're looking at histopathology.
Yeah.
All the tumors had good margins, which means we got clean margins on all of them, which means for that tumor
Right.
and there's nothing. There's no part of the edge of the tumor touching the surrounding skin.
Yeah.
So at this point, we're waiting. So I called, this morning for a consult with Dr. Anderson, who's an oncologist, just to chat with her about, Palladia, which is a really good option for dogs with mast cell tumors. But I don't think that at this point that's something we're gonna.
I mean,
consider.
look at him.
I know.
Yeah.
He's doing really well, and the tumors aren't, knock on wood, popping up like super rapidly. So for now, I think surgical management is going to be appropriate. But at some point, it's very likely that he will be on Palladia, which is a
That's just something we want to wait as long as we can, right?
kind of.
You don't really want to.
You
go
don't
too
want to wait
soon?
too long, but
Right.
you also don't want to do it too soon
Right.
because the sooner you do it, the more likely you are to have issues.
Yeah.
Their liver values will elevate sometimes, or white blood cell counts will get low sometimes. Oftentimes, if that happens, that doesn't have to be the end of the journey, but we'll take them off the medication, make sure that they're normal, and then put them back on at like a lower dose, maybe 25-30% lower than they were on previously, and a lot of the dogs continue to do well.
Yeah.
But it is one of those things where I feel like if you started too early, maybe complications from that medication catch up with you
Right.
before complications
Yeah.
of cancer.
I mean, we've all seen the commercials
Yeah.
where the complications are going to kill you, but the actual thing you're dealing with is just bad skin.
Yeah.
Yeah. So.
Yeah. I just saw a comedian the other day who had a thing on that was super funny. Can't remember who it was, but yes, we don't want to. We're doing no harm.
Right.
One of the things that I talk to people a lot about with like our dogs and cats is that we're not trying to cure them of cancer. We're not trying to burn them up with chemo,
Right.
radiation.
Right.
Like when we do chemo and when we do radiation in dogs and cats, we're really just trying to give them a good quality of life. Trying to make sure that they have whatever bit of longevity we can give them. But the main thing is we're not going to burn them up. We're not trying to make the last several months
Miserable.
yeah. So then when I talk to chemotherapy, when I talk to people about chemotherapy and radiation and stuff, a lot of times like they're like, well, there's no way because my mom had chemo or my dad had chemo, and
you know, it ate them up and, you know, they were miserable the last couple months of their life. We're not going to do that
Right.
with dogs and cats.
Right.
That's not our goal.
Right.
If the dogs have any issues with medications that we're giving them for that, you know, for cancer, chemo, or any of the medications, we discontinue them, and almost 100% of the time, I can't even think of one time that I've done this where the dogs don't go back to being, you know, well. And that's just our goal, is to keep them as comfy as possible.
Right.
So for now, this is definitely not the end of life for us. With
That
Tonka.
is so awesome.
Yeah, we have a lot more adventures to go on.
Oh, I'm so excited.
Yeah.
Well, I think we were both right. We didn't feel like he was
Decisions.
going anywhere.
Great. Yeah, you're right. Yep, we got a ways to go. I want to chat with Dr. Anderson now a little bit,
Okay.
about, you know, where we need to go as far as, you know,
Yeah.
we'll see if we can come to an agreement on that.
I was curious about, I know you said that the one spots that you have are flat.
Mm-hmm.
Is there any way for me to see them more, like when I'm checking him, when I'm looking at him?
Honestly, Ryan, the only reason why I found those is because we shaved him.
Right. So short of shaving him.
Yeah, I mean, we're not.
A lion.
Yeah, a lion would actually look good.
Yeah, he definitely roars
He
like
could,
one.
he could rock a lion. Yeah.
That was such wonderful news. My healthy boy, well, healthy-ish. I mean, that was literally the best news that we could have gotten. Thank you all so much for all of your prayers, for all of your encouraging comments. Man, when I was at my lowest, you guys brought me up. And I cannot say thank you enough for that. The support you've given to us and the prayers, they really truly mean the world to us. Thank you so much. And we will keep an eye on this boy. And even if we have to shave some spots to make sure that he doesn't have any more tumors, we will. God is good. And so are all of you guys. We are so blessed to have you. Thank you. I'm gonna go.